Hey there, it's Kat here again and welcome. And if you're new here on this channel, then I just wanted to give you a quick rundown on who I am and why I do these videos. So basically I live in Australia and I'm a beauty therapist and also a massage therapist. I work in a spa doing majority massage and a lot of facials and skin treatments. So my interests are just general wellness, nutrition, living a happy and joyful life. But I'm also big on kind of treatment-based massage. So I'm studying a diploma in remedial therapy, and I am really interested and big on skincare ingredients, cosmetic science, and skin science in general. So that's why I'm doing this video. I reached out to some of my followers and friends, and I got a really good list of questions about skincare, so I wanted to answer them today. So stay tuned. I'll try not to make this a long video because I'm notorious for that. But I probably do suggest, you're welcome to, when it comes to my videos, I do sit down talking videos. So the way I listen to them is I'll do the dishes, put my phone there, and I'm just listening to what the person has to say for these types of videos. And for now, with my lack of editing skills, you'll be seeing these kinds. So I think it's more important to get the information out there than, I guess, focus on my video editing skills at the moment. So that is what I'll be doing. Without further ado, I'm going to answer all these questions. So I do have a book here. I've written them down so I don't forget anything, and I'm just going to answer them one by one, and hopefully this helps. So the first question that I received, I really like this one, and it came from a friend, and she asked about the condition called Milia. So Milia, she has them on the top of her cheeks, and that's where they're often found, around the eye, and basically they look like little white dots, like lumps, and they're kind of hard, and they stay under the skin and they don't move. They are kind of there permanently. So basically what they are is just a mixture of sebum, dirt, mainly sebum though, which is kind of hardened and is kind of formed a solid, and they just get trapped under layers of skin, and these aren't something you can pop. Please don't try and pop them. You'll make yourself bleed. There is a few things you can do about them though. So the person I'm talking about, she said she was scared of needles, and she didn't really want to have them kind of removed in that way, but I have to say that is probably the most effective method. I'm going to give you two though. So in clinic, in a sanitized, a sanitized workplace where no cross infections or whatever can happen, we use like a little, I think it's kind of called a lancet, and it's a really, really small needle, kind of like with a hollow in bit, and all you need to do is prep the skin first, and you literally just do a little prick into the skin. You probably won't even feel it. It's probably the tiniest, I haven't had it done myself, but it's the tiniest little prick, and all we do is just prick the skin and then just push the milia out. It's just trapped under there and it needs to come out if you don't like looking at them. I'm a little bit unsure of their cause. I can't say a definitive cause, but I theorize that it's to do with dead skin cell buildup, possibly using too heavier products around the eye area. I think it's a genetic component as well. So a lot of people get them, a lot of people don't. Easily remove them that way. However, if you don't want to go down that route, and I completely understand, but what you're wanting to be doing is some very, very gently exfoliating the areas. And I'm not talking about abrasive things like a crystal or beads or nut kernels or whatever. Don't use abrasive. You want to be using something like an AHA or a BHA, which is a chemical ingredient that basically helps to break down the dead skin cells. It actually breaks down what holds the dead skin cells together. You put it onto your skin, leave it there, it does all the work, rinse it off, and you're done. Most commonly, most AHAs and BHAs come with other good benefits. For example, lactic acid is also hydrating. Salicylic acid is attracted to oil and helps to break down in the pores a lot better, but it also is a bit of an anti-inflammatory as well. So you can see why I like them better than abrasives. And just on that as well, abrasives, all they're doing is breaking down the cells, and you're rubbing and you're creating a bit of erythema. I'm sorry, that means redness. And yeah, a lot of them just aren't suitable. Do something nice and gentle like an AHA or BHA. But for Milia, you might need to be careful in finding something with quite a low percentage. So something that is going to be okay for this delicate eye region. So I actually don't have any products on hand that I could recommend, but for this person, I'm probably going to make a personalized recommendation to her. I really love affordable yet good quality skincare. I really like Paula's Choice. They have an online store, and they have good ethics when it comes to skincare, and I really appreciate that. A lot of skincare companies don't really care about the health of your skin, they just want to make money, but Paula's Choice cares about your skin. So yeah, like I said, either using a little needle to pull it out, push it out, create an opening, or you're wanting to be gently over time. One treatment's not going to do it, you'll be doing over months to kind of break down that dead skin that's over the top of the milia, and you may see some results. However, I've never treated that with AHAs or BHAs before, but it is known for a treatment option. So that's Milia. All right, so on to the next question. I really love that you guys have asked this question, because there's a lot of misconceptions around it, and it is about pore size. So just a little backlog. We have pores all over our skin. You could call them hair follicles as well. It's basically a little opening where the oil comes out, the hair comes out, and it's kind of the entrance into the deeper layers of the skin. So people are concerned about larger pores, and I completely understand this. You'll often find larger pores around the nose, the T-zone, usually where you've got more of an oil production. So the reasons why you might have larger appearing pores is, once again, oily skin. It could be from aging and sun exposure, and you might not have guessed that, but the sun damages your skin at a very intense rate. And basically, as your skin ages, your skin cells don't really behave the same way. So if you're damaging them with UVA and UVB rays, your things aren't going to work as well. So yeah, definitely the sun. It could also be from clogged pores as well. So having maybe you're not exfoliating regularly enough, or maybe you're not using appropriate skincare. You might be using skincare that's comedogenic, so it's actually blocking your pores. And basically what a large pore or a blocked pore is you could think of your follicle, your pore kind of like going like this, and it's kind of blocked and everything's sitting in here. So you want it to be cleaned out, and because what happens is a blocked pore underneath, your oil's trying to come up, but it can't. And this is kind of like a blackhead, for example. You've got the darker color on the top. It's there's dirt, debris, oil, whatnot. It's blocked, and you've got oils that need to come out. They wanting to help your skin. Oils are good for it, by the way, for your skin. And it's trying to come out. It can't. It's blocked. Infection, inflammation, and that's a pimple. So that's kind of what blocked pores are. But what I want you all to know, pages keep moving. What I want you all to know and understand is that a pore does not react to stimuli. So a pore is, it's not something you can just open and close. A pore is there and it serves a duty, and it doesn't move. It's what it is. It's a structure, and it just is a place for the oil to come in and out and whatnot. So you can't really expect too much of them, but what you can do to reduce the appearance of large pores is also using AHAs and BHAs. The BHAs are going to help clean out the dirt and debris in the pore, and therefore kind of creating a smaller appearance. The large, you know, if you've got things in there, you'll often see it on your nose. It's more noticeable. It's creating that kind of crater look, and if you just clean that out and over time refining the skin through AHAs and BHAs, you're going to notice kind of like a reduction in size. So I definitely recommend that. My second tip is using a retinoid, and retinol is fantastic for refining the skin, improving the texture and tone. It also helps to reduce breakouts. So definitely a retinoid is going to help, and using an SPF daily, just for all skin concerns and conditions, but using an SPF is also going to help with your pores as well. Also making sure that you are not contributing to comedogenesis. So making sure that all your makeup isn't causing blocked pores, making sure that you're not putting anything dirty on the face. So that includes your pillowcases. Change them, you know, once every 2 to 3 nights. And I'm serious about that one. Especially if you have oily skin, flip it every night, change it every second day. You produce oil during the night, and your pillows get dirty. You sleep in them for, sometimes I know people that have slept in their bed sheets for more than 2 weeks. I only do a week, but yeah, you just need to change those pillowcases quite often. Also, what else can lead to blocked pores? Yeah, maybe just not having a regime that's effectively, you know, balancing your oil production. You know, some moisturizers or products that you're using might be comedogenic. So just keeping all of that in mind, cleansing effectively, exfoliating regularly with the AHA and BHA is going to help. So I hope that helps. Let me know if you struggle with finding some products, and I would probably definitely recommend some good BHAs and AHAs from Paula's Choice. I really like their products when it comes to those. So just ask me down below for a more personalized approach. Next question. So best cheap skincare and makeup, and I really appreciate this because we all wanting to save our money, but when it comes to skincare, I find just depending on what you're wanting, you may not be able to find it in a cheaper version. So you just have to keep in mind that there's a lot of ingredients out there that cost a lot to make. So something like retinol, for example, that is more of an expensive ingredient, and you probably don't want to be buying retinol in a product that is, say, $20, because it's probably not in a well formulated way, and it's probably not going to do anything for the skin. So for skincare, if you want something that's a good skincare line that's cheap and effective, I mentioned it before, Paula's Choice is fantastic. But then again, you know, you really have to weigh up what your goals are. So if you're wanting, you know, amazing anti-aging results, I would go to a skin clinic such as mine. I work at Cocoon Spa in Adelaide on McGill Road, and we sell a brand called Cosmedics. I'm really in love with them at the moment. And for example, their anti-aging line with really high amount of actives, up to 85%, which is amazing for skincare. And their products are a bit more on the upmarket end, but not that expensive. For example, a cleanser, $52, lasts you ages. A retinol serum, $92. So more of a bit more expensive, but still I would say cheap for the active ingredients. Paula's Choice products are a little bit cheaper, but yeah, I haven't used their products as much to really say how good they are. I'm just reading reviews on the internet. I do have a tip though for saving money with skincare, and that is spending your money on products that are going to make a bit more bang for your buck. So think about this. Your cleanser is only on your skin for what, 30 seconds? Maybe a minute or two if you're cleansing well. And although you might have ingredients in there that are encapsulated and you know they are on the skin for that short amount of time, you're washing it down the drain. So really, if you're wanting to save money, get a cleanser that is gentle but effective. It's not stripping your natural oils, and you can save a little bit of money. Unfortunately, I don't have any good recommendations for you know, pharmacy or Woolworths or Maya kind of buys. I endeavour to find a little list, like a go-to list for you guys, because I know not everyone can afford cosmeceutical or professional skincare ranges. So I promise you, I am on the hunt. I'm going to try out some products, and I'm going to give you a big list of skincare that is affordable and safe for your skin. Makeup, I'm sorry, it's not my expertise. However, can't answer that. I'm not sure about cheap makeup because, yeah, I'm a bit funny with what I use. I try to use as natural products as possible. They've got to be vegan friendly and effective. So I use nourishlife.com to buy all my makeup, and I've been pretty happy so far. Their prices can be good, like quite low to expensive, so it really depends what you're after. But there's some amazing makeup artists out there that can answer that question better for you. Oh, this, I just picked it up for some reason, but this is my favorite mascara. It's about $32. It's from Nourish Life, 100% pure. Smells like chocolate. And it is a brown mascara and all natural, toxin free and whatnot, and really easy to remove at the end of the night, so I'm not kind of rubbing at my eye area and causing aging in the long run. Side note. Next question, dry skin and peeling on the nose. So it's a really good question. So I'm assuming this person, it could go kind of a few different ways when you're having dry skin and peeling, but usually that means that the skin is not desquamating at a good rate, and desquamation just simply means the removal of dead skin cells. So it's the cell, it's the lifespan of the cell. It goes from the bottom, goes up and goes off. So that's the off part, is desquamation. So it's probably due to dry skin. Dry skin does slow down the desquamation rate. So what do you want to do for dry skin? Well, I would suggest a really, really gentle exfoliation about once a week for dry skin. I would use an AHA, and that's just going to help, or even a fruit enzyme peel. So Cosmedics makes a really good one as well. Enzymes are similar to AHAs, but they basically just eat up the dead skin cells like Pac-Man. But I would be putting something like that on your skin and choosing products suitable for dry skin. So no alcohols in your ingredients. But a side note, some alcohols are in skincare for a reason. It's to emulsify the formula. But then you've got your good and your bad alcohols. I'll put a link down below to a esthetician who does a really, really good video on good and bad alcohols. So if you want to watch that to find out more information, go watch that. But yeah, no bad alcohols, no fragrance on the skin. That includes perfume and essential oils. They're irritants, and dry skin is already vulnerable, so you don't need to be putting on these irritants. Well, they're actually drying as well, so you don't want that. But basically, make sure with your cleanser, you're not stripping your skin. Make sure maybe it's a really nice creamy cleanser, and just really focus on hydrating your skin. So you could use maybe a hyaluronic acid serum, and hyaluronic acid is already found in our skin and basically attracts 1,000 times its weight in water. So it's really good for holding onto hydration. Couple that with a really good moisturizer and an SPF, and over time you will see some differences. But I think it's one of those things you really need to tweak and change, but make sure you're exfoliating as well, because that'll help with dry skin in the long run. And yeah, here's a question: what's the deal with exfoliation? So I wanted to be really quick on this one, but I said before you could use something like AHAs, BHAs, or enzymes. So they're usually like a leave-on product. You would paint them on the skin, avoiding, you know, this orbital area here, and don't go too close to the lip. And they're going to either eat away the dead skin cells, like Pac-Man being an enzyme, or the AHAs and BHAs breaking down the dead skin cell, what's holding them together. Really gentle, and they usually come with other benefits, like I mentioned before. So depending on your skin type, you might need to do it 1 to 2 times or 3 times. Sometimes, generally the rule is a drier skin type will be less and an oilier type will be more. However, your skin condition may not allow for that, such as rosacea, where you might have oily skin mixed with a bit of sensitivity and redness. So if you're going to be exfoliating your skin, it's going to cause more irritation if you have rosacea. So it's one of those things you got to play around with. It's so individual. Everyone is going to need something different, and it will change from different seasons of the year. So keep that in mind, get some expert advice, and just avoid using abrasives. Please, I ask you right now, if you have St. Ives apricot scrub in your shower and you're using that to scrub your face, please stop using it right now. I pick on this product because it's just so notorious for damaging your skin. So basically they crush up apricot kernel, no actual apricot, but the apricot kernel, which is a hard substance. Imagine blending that up in the blender. You get small little particles, and basically they come out in irregular shapes, and they pop that into the exfoliant. You're sitting there scrubbing your face, and over time you're actually creating tiny little micro tears in the skin. Micro tears in the skin are going to leave your skin more susceptible to infection, breakouts, sensitivity. Oh, the list goes on. You don't want to use it. Stay away from scrubs. They can be good for short-term use and once every now and then, but essentially, yeah, they're just not that good. So if you can choose something better, definitely go for it. Unfortunately, there isn't many good exfoliants on the market when it comes to supermarkets and pharmacies, but there is probably a few in there that I would say are gentle enough. But yeah, once again, I'll probably look into this a little bit more for you guys, so I can give you kind of a cheap skincare recommendation. But yeah, Paula's Choice for now is a really good place to go for your cheaper, more effective AHAs, BHAs, and enzymes. So yeah, I hope that really helps. You can also do a gradual exfoliation, so a leave-on exfoliation product that you put on every day. It's usually a lower percentage in AHA or BHA, and that will help to exfoliate skin on the daily basis. So that's also an option. My next question on the list is, what is the most essential part of your skincare routine? And I've said it before and I'm going to say it again, but it's SPF. By using an SPF on your skin, you are preventing so many problems, and you're slowing down the aging process as well. So the sun is the biggest cause of aging, right next to sugar and smoking. So if you can just simply put on a good SPF every day that is cosmetically elegant, feels nice on your skin, doesn't block your pores, then you are going to have healthier skin, more radiant skin. You're not going to develop pigment. You are not leaving yourself vulnerable to skin cancer. My goodness, you don't want that. So just use a SPF and you'll age slowly, and you will be happy for it when you are 50 years old and still have, you know, quite firm skin. So definitely that is the most important part. My next question is, what are toners? And this is a really good one because toners have a bit of a reputation and a lot of misconception. So back in the day, toners used to kind of act as a side, kind of like as a, you would use them with your cleansers. So there would be like the second part of your cleansing. So the cleansers were originally really stripping on the skin and really alkaline. So the toner would serve as something to bring back the skin to an acidic level. It sits at 5.5 on the pH scale skin. So that's what they were used to be used for. And now that we have better technology, more understanding of cosmetic skincare, we don't really do that, and we don't really advocate that. So toners are generally used for a few different things now. So you might see micellar toners, you might see hydrating toners, you might see something like a witch hazel, or you might see more of the active professional brands using toners for just a delivery of more effective ingredients. You also might see toners that help with exfoliation as well. So a really diverse product, and to be completely honest, I'm not 100% sold on them. I think any leave-on product is going to be more effective than a wash-off product, but it really just depends. I think if you want to save your money, don't worry about a toner. But if you do, want to add some extra hydrating properties to your routine, then go for it. At the moment, I'm using something that kind of helps to get rid of the last little bits of my makeup and helps to protect my skin against free radical damage. So it has extra benefits, and I'm just trialing it out. So that's an example of how you can use a toner. But I wouldn't recommend toners probably from most of the supermarkets, because they're usually really high in alcohol, and alcohol is drying, it's stripping, it's not good for your skin in the long run. So yeah, really just play it by ear with toners and get some good advice. That's toners for you. But yeah, like I said, don't be put off by them. I think they're good still. Got 2 more questions. So face washes, are they too rough? And this is debatable. So I was using face washes for probably a year, and I had no problems with them. However, I've just switched away from face washes, and I'm now using a really nice soft cleansing cloth. And I found that this, when I remove my eye makeup with it, it's a lot more gentle and it's not stretching the skin. So I'm probably more leaning towards cleansing cloths that are really, really soft and gentle. You want that on the skin. But if all you have is a face washer and you're just, you're not using the same one every night, you're putting it in the wash and getting a fresh one, and you're using warm tempered water, I don't think there's any problem with it. You are gently exfoliating somewhat exfoliating the skin when you do it. It might not be appropriate for all skin types, but I don't think you're harming the skin by using a face washer. Some people might argue this, and please feel welcome to tell me your experiences, because we are all learning here. But yeah, that's the deal. So last question, what is the order to apply your products? I'm really quick on this because I might do a separate video on it, kind of giving you a bit more of an idea. But basically, you're wanting to cleanse, then tone if you're toning. So cleanse, remove, tone, and then you might be leaving, say, a leave-on exfoliation product on, but if not, you might be just going straight to your eye cream or your serum. So either one of those you pick. I would say use your eye cream first and then serum, then you're putting on a moisturizer and then your SPF. So it's usually in order of weight and molecular size. So I hope that helps. And that does bring us to the end of the video. So I really love doing videos on skincare and answering all your questions. Really glad that you asked all these very insightful and inquisitive questions, and I look forward to talking about this stuff more. So thanks for tuning in. I hope I've answered your questions. Once again, pop them down below and I'll try to help you out. So just letting you know, I do have a Facebook and Instagram, so come and join me on there, and we can chat more. All right, have a wonderful day and speak to you soon. Bye.